aspirin and digitalis leaf, which is wildflower, which is the wildflower foxglove, was used to strengthen the heart. So you see that whoever had pneumonia was pretty busy treating himself. Another leading cause of pneumonia in the county was asthma. Now, asthma is frequently diagnosed in a patient that has very short breath, wheezing, coughing up clear sputum, but didn't have any fever and doesn't feel terrible. And they also know they've had histories of asthmatic attacks. The treatment is injection of epinephrine back then, and sometimes it's still used today. The other treatment was something called Asmodor. Now, Asmodor is a common drug used in these attacks. It is a powder of potassium nitrate, which is explosive, and aniseed, an herb, and loco weed. Now, loco weed and Jimson weed are the same. And the loco weed, if the cow eats loco weed, they get kind of disturbed, I think, because I think it's kind of why I call it loco weed. Anyway, the patient will take about a teaspoon of this, a couple teaspoons of this Advil, put it in a saucer, strike a match, inhale the flame, the fumes, the smoke. And that has in it, scopolamine, icosapent, and atropine. And it would dilate up the lungs, the bronchial tubes a little bit, and definitely dry up the mucus. I had another experience with Asmodor. Years ago, Dr. John Hammond and I supervised and worked in the old St. Elizabeth Emergency Room in Covington. That was in the early 70s. I was working one evening when two teenagers came in, very disoriented, with very high fevers. And after a discussion with the mother, who was an asthmatic, we determined that they'd eaten a couple teaspoons of Asmodor. So, and that at the time, the drug generation started in Covington about that time, I guess. But these people they were trying to do something with themselves that they shouldn't be doing. There was a jingle that you all should remember. I want you all to remember this jingle, because if you ever run anybody with atropine poisoning, this jingle will explain the whole thing. The atropine patients, or poison patients, are hot as a hare, red as a beet, dry as a bone, and mad as a hatter. And my patients were all these. But they were treated with IVs, and I can't remember, I suspect they survived pretty well. Asmodor is a really potent drug. It's not used today. Now, Boone County also had a share of tuberculosis, which is a very dreaded disease years ago and even today. Tuberculosis can affect your spinal column. It's called Pott's disease. Your glands, called scrofula. You can get TB meningitis. But by and large, most of it goes to the lungs. And when it goes to the lungs, you won't really see it very well. It's the upper portion of the lungs. I've kind of outlined it a little bit in blue, but it's the upper lobes of the lungs is where the TB goes to. CE has good mechanisms to diagnose it these days: CAT scans, chest X-ray, blood tests, and sputum culture. But the old doctors in Boone County years ago didn't have such. They did it with percussion. And when they did that, they would notice a difference in the sound. The pus mucus would be clogging the lung up in this area, in the upper part of the lungs, and it wouldn't sound the same. It'd be dull. You wouldn't hear breath sounds. So they kind of decided the person had TB if it's coughing, and had those findings on a physical examination. The treatment was that they would have the families wear masks, because tuberculosis is an airborne spread disease on droplets and sneezes from a person who has tuberculosis. So therefore, they recommend the family wear the mask. The sputum was treated like poison. It was collected, covered with borax, and burned. Some of it was sent off to the state. Now, the state had a lab that could probably grow out mycoplasma tuberculosis and prove that that's what the patient had. And if the patient had tuberculosis, then he would be voluntarily or involuntarily sent to the TB sanitarium. Now, I think there might have been one on Kyle's Lane. I'm not sure. There was one around someplace. Other physicians practice in the county as well, but I had a hard time finding about their details of their practice. Dr. Young had an office in Burlington, and for many years he practiced there. Some of his books were over there. His widow gave those to me about 30 years ago. And if you read those, you'll find some quite hair-raising treatments. Dr. Nunley was another famous physician in the county, whose lovely wife was quite helpful in obtaining medications for the community. In 1856, Adolphus Sayre of Rabbit Hash and his son Frank Sayre of Hebron, they practiced, and they were identified and referred to as a saddlebag doctors. And there was another fellow in the Boone County Recorder in 1845. Dr. Kim was noted that he bought new saddlebags for his horse. So they made house calls and took the medicine with them. And can you imagine calling the doctor and having him come up in your driveway in with this horse saddlebag? These days it would be a 360 horsepower Mustang convertible. In those days it'd be a horse and saddlebags. Dr. McKenzie was in the same edition of the Boone County Recorder, advertised that he sold notions, stationery, and medications in his store in Burlington. And some of those medications those days were kind of interesting to me. And the patients called the medicine by color, like, oh, doc, I want that green pill maybe better last time. And they always wanted to color certain kind of pills. The pink pill could have very well been snake root, which a flower that is reserpine, which is a good anti-hypertensive drug. I used it a lot in the past, not any longer. It's kind of off the market. But it was only about $6 a month, and it really did lower your blood pressure. Made you have a stuffy nose. The black pill was charcoal that was squeezed into the pill. Now this medication was good in absorbing toxic materials from your stomach. Most doctors had this in their pharmacy. Now, you have to remember now, the pharmacy a doctor had was these little bottles, either in a bag or saddlebags, or in his doctor's case, little bottles had different colors of pills. He'd shake them out in a little envelope and say 3 times a day. These days, it comes with a vial that's got everybody's name on it, the drug, the amount, who filled it, where it come from, the telephone number of the drugstore, and they almost all have it on the side so it can cause dizziness. Then they give you a pamphlet to go along describing that medicine. Whereas the older doctors just gave you a little bag that says 3 times a day. A lot more simple. The charcoal is still used today. In people in emergency situations, if somebody's in a hospital that OD'd or took some toxic material, you put activated charcoal into their abdomen, and it kind of grabs onto some of those chemicals and takes them on through. The mercury thermometer is kind of gone by the wayside, like a lot of mercury products, but it really did give a good core temperature. Today, the average physician office uses something that's fast and disposable. There are two other doctors added to our county's reputation. One was my brother, William Markesbery, who was a neuropathologist. Now, a neuropathologist is a person that examines the brains during autopsy, dissects the brains and studies the brains at autopsy. For 30 years, he ran the Sanders Brown Institute of Aging at the University of Kentucky. He presented more than 40 papers on Alzheimer's disease and had a muscle syndrome named after him by the American Board of Neurology. The NUN study was a collaborative study involving several medical schools and universities. My brother contributed a lot to that, and when he did that, he would examine the brains of nuns that had died at Gethsemane Seminary near Frankfurt. He would inspect them, he would compare the ones that had Alzheimer's to the ones that didn't have Alzheimer's. Of course, and the reason they chose the nuns is because the nuns lived a kind of a cloistered sort of lifestyle, not like you and I. And they thought that would give a good I'd be a good study for Alzheimer's disease. My brother was quite a gentleman, immaculate dresser, loves his silver Porsche. He was quite a UK fan, and actually he walked on in 1950 on Adolph Rupp's team and made the team, but however they were suspended and didn't get to play. Dr. Sam Hoppen was another remarkable Boone County product. I only met him once. That's when he lapped me in a mile race at the old Boone County High School track meet in 1954. He went on to go to medical school and did research in California. His son wrote a book about him, and the book was made into a television series starring William Shatner. The name of the series is Blankety Blank Blank, My Father Says. Now, thank you very much. Your attention was great. And if anybody has any questions, if somebody's got some stories about divers except me, then we'd like to hear them. Thank you.
Does anyone have any questions they'd like to ask? We wanted to give Dr. Markesbery, and we do this for our speakers, not to our speakers. But this is the history of Boone County, and we want to present that to him. Dr. Markesbery, we appreciate you coming. It was very good. Very good.